Hello, and welcome to Adolescent Medicine Consulting's video for the week of February 26th, 2024. My name is Beharry. I am a pediatrician and adolescent medicine specialist with over 20 years of experience helping teens, tweens, and young adults in a variety of settings. I started Adolescent Medicine Consulting to help share some of the skills and knowledge that I have gained so you can help the teens in your practice and in your life. For those of you who've been following along, thank you for continuing to tune in to these videos. For those of you who are new to the video series, welcome. After you watch today's video, I invite you to look back at some of the previous videos that dealt with stress management and other adolescent health issues. Today, I want to begin a new series to empower you to respond to common issues that may arise during the confidential part of an adolescent health visit. I'm calling this series What to Do When. As a reminder, these videos are for information and educational purposes only. They are not a substitute for your own clinical judgment and do not constitute a consultation. The psychosocial assessment is a key part of an adolescent health visit. Why? Well, most of the risks to the health and well-being of an adolescent are from their behaviors. The top 3 causes of mortality for teens in our country are accidents, suicide, and homicide. I can listen to a patient's heart and lungs all day long, and it will not tell me if they are at risk for an accident, suicide, or homicide. But a few minutes of confidential conversation can. To help structure the conversation, and more importantly, the reporting of the confidential discussion, adolescent medicine specialists have developed different tools and mnemonics. The most well-known mnemonic is the HEADS assessment. Depending on who you talk to in adolescent medicine, you may hear different information, but the HEADS assessment was developed at Children's Hospital, Los Angeles, which is also where I completed my fellowship. Indeed, when one searches the medical literature, the earliest study published about the HEADS assessment came from CHLA. The idea is that one progresses from talking about things that a patient expects to talk about during their medical appointment, like their home environment, to more sensitive topics like sexuality and suicidality. While I know that there are many health professionals who run through the different domains of the HEADS assessment like a checklist, I prefer to have a conversation with the teen. This means that I may not run through the questions in a prescribed order. Additionally, for many teens, for example, those who are in foster care or those who are experiencing homelessness, talking about home can actually be more difficult than talking about substance use or sexuality. One of the newer modifications to the psychosocial assessment is the addition of another S for strengths to make the word shades. In addition to these verbal screening tools, there are many written or electronic options for obtaining a psychosocial history. For this video series, I will focus on what to do when you get a positive answer, rather than the merits of the different screening tools or how to best get the information from the teen. That being said, we will start with H for home, as in the classic HEADS assessment. Because there is a lot we can cover as we explore the different domains, I will divide them up and focus on some general information. For more detailed information, or if you have a specific question, please reach out to me at Dr. Beharry at adolescentmedicineconsulting.com. That's dr.beharry@adolescentmedicineconsulting.com. Today, I want to focus on the place where the patient lives as we talk about H for home. There are lots of different places a patient could live. A house, an apartment, a condo, a trailer, a hotel, a group home, a homeless shelter, or on the streets. Getting information about the different places where a patient lives can be challenging, but it is very helpful when you have it. Let's say you found out that your patient was living in a home with lead paint. What would you do? Would you know what to do? Well, for those of us who are pediatricians, the answer is probably yes. We would draw a lead level. If it's elevated, we provide treatment, report it to the state, and contact the appropriate lead abatement resources in the community. What if your patient shares that they're couch surfing? That is, they're moving from place to place because she has no stable place to stay. I know you may be thinking, Dr. Beharry, youth homelessness is not a common problem. However, recent studies indicate that as many as 2.4 million young people in our country have experienced at least one night of homeless in the study year. So there are lots of young people who are experiencing this problem and who may not be disclosing it when they come in for a visit. Talking about how we elicit a history of housing instability or homelessness is a bit more nuanced and not the focus of the video today. If you'd like more information about questions that you can ask to get the history, you can check out this article that Dr. Christensen and I wrote for Pediatric Clinics of North America a few years ago, or you can contact me directly. Once you have the history of housing instability, you can help your patient by talking to them about different resources. Certainly, if you have a social worker in your practice, you will contact her with this information. But if she's not available or if you don't have a social worker, you can start by assessing for common health issues that affect youth experiencing homelessness. These include, but are not limited to, asthma. And actually, sometimes when you see a patient who has chronic asthma and they're having more frequent exacerbations or they're asking for more and more refills of their medications because they left them here or there, and that can be a clue that they are couch surfing, experiencing homelessness, or in a setting that is, for whatever reason, exacerbating their asthma. Obesity and malnutrition. Certainly, obesity is a common condition that we see among young people nowadays. But when someone's not stably housed, they are very reliant on fast food for most of their nutritional needs and can progress to a level of malnutrition based on having primarily fast food as their means of nutrition. Dental problems and vision problems. In surveys and studies of youth who experience homelessness, we know that many of them don't have access to dental care and or have vision problems. It is unfortunately pretty difficult to access dental services and vision problems when folks are in shelter or if they're moving around a lot. Injury. They might have injury because they are in a violent situation and that precipitated their move to an unstable housing situation, or because of their unstable housing situation and needing to fend for themselves and getting lots of minor injuries as they try and scrounge for food and other resources. Infections. Some common infections that we think about are and associate with homelessness include things like tuberculosis, hepatitis A, hepatitis C, really any of the hepatitises. We also know that when people are in crowded conditions, they are more likely to have infestations from things like lice. Pregnancy and STIs. Many young people who are unstably housed or homeless are engaging in sexual activity in order to maintain a safe place to stay or to get food or shelter. As a consequence, they are at higher risk of having a pregnancy or a sexually transmitted infection. Another challenge is that they might not have safe and reliable access to contraception, again, putting them at higher risk for pregnancy and STIs. Mental health issues are also pretty common among those experiencing homelessness. Not surprisingly, PTSD is pretty high, either from the trauma that led to the young person being on the street or because of traumatic experiences that they have experienced since they have been living on the streets. Depression and substance use are also pretty common as the young person tries to cope with their very difficult circumstance. This isn't to say that if a kid has any of these conditions that they are necessarily homeless, but if you are seeing more and more of these issues pop up, maybe looking a little bit more closely at the young person's housing situation can help. Thankfully, there are many resources to help those who are experiencing homelessness, as well as those at risk of being homeless. There are different benefits and services such as WIC, Women, Infants, and Children, to help young people get adequate nutrition and food. SNAP, Supplemental Nutrition Assistance Program, previously known as food stamps, to help people with getting adequate nutrition, and TANF, Temporary Assistance for Needy Families. These are programs that a person needs to apply for, so having the assistance of a social worker and or any services that can help with these forms is greatly appreciated for people, especially if they do not have a stable place to stay. Additional resources that vary widely depending on the community you're in include local food banks, drop-in centers where young people can go during certain times of the day to get some meals, to get a hot shower, use some laundry services, things like that are also very helpful. Every state in the United States also has a state coordinator for the education of children and youth experiencing homelessness. If you need some help getting the resources that can connect you to the state coordinator for your state, definitely let me know, or check out the information in the comments box associated with this video. Communities and schools can also help with connecting a young person to needed resources. For a lot of young people who are experiencing homelessness, the connection to the school is vital. It is one of the few places where they can connect to adults, blend in, and get some assistance to move beyond their current situation. In addition to the local and state resources, I like to share hotline numbers with patients. Since some patients may not be comfortable disclosing their housing troubles due to the stigma of homelessness, I recommend leaving magnets, posters, or brochures with the information about these different hotlines in different areas of your office space. So there's the National Runaway Safeline for young people who have run away from home or been kicked out of home, 1-800-RUNAWAY, and we also have the website. There is National SafePlace. This is a resource that I like to recommend to young people because this logo that you see can help the young person identify a safe place to go. In some places where I've worked, they have managed to train all the city bus drivers to be a safe place. Many fire stations and other community centers are part of SafePlace. The idea is that any of the workers there have been trained on how to link a young person who says that they need a safe place to stay to a local shelter so that they are not at risk of all of the different dangers that they can experience on the streets. I also like to share the National Human Trafficking Hotline. There is a website where one can make reports about concerns related to human trafficking, and there is also the hotline number 1-888-373-7888. We usually like to encourage people to share that number as 888-373-7888. It's a lot easier to remember. 888-373-7888. So that way the young person doesn't have to write it down where it might be found by the person who is trafficking or abusing them. Thank you for your time and attention to this brief video on how to help a young person who is unstably housed or experiencing homelessness. I hope these resources are helpful for you and the young people in your life. If you would like more information about any adolescent health issues, please reach out to us at www.adolescentmedicineconsulting.com. If you would like CE credit for this experience, please follow the link in the text box related to this video for CME credits from CMFI. These reflection credits are available for a small fee. Please keep tuning in for other videos from Adolescent Medicine Consulting where we help you help teens. Thank you.